And good afternoon. Welcome to Special Report Afternoon Edition. I'm joined today by Alex Parr, who will be my guest co-host for the foreseeable future, as Colette Linden is off for medical reasons. If you'd like more information about why Colette's not here, you can go to our Facebook page. It's pinned at the top. You can go through and read what happened on her GoFundMe page. And also I will be posting that into the chat on Facebook Live. If you'd like us to say hi to you today, or you got a birthday or anniversary or something, or it's someone just graduated high school, you want to let us know and you want us to shout out on air, just go to our Facebook page, click on the live video, you'll have a chat, and just post it into the chat there, and you can interact with us live on TV. Can't get any better than that.
Pretty cool if you ask me.
Alrighty, speaking of cool, weather.
Ooh,
yes.
That was smooth.
Yes.
That was good.
Thank you. It's perfect segue into it might not be cold for once.
Oh.
Yes, it is 25 out there right now.
Yeah, I had to change. If you guys watched the morning edition, I was wearing like the jacket, the shirt, long sleeve shirt. I was melting. I switched it. Now I'm repping my Leafs and the short collared shirt.
Oh boy, Leaf fans.
Oh boy, Liverpool fans. At least you know what winning's like. At least you know what winning's like.
Yeah. Yeah, it's been over 60 years, hasn't it? That's like double the amount of time it took Liverpool to actually win another Premier League.
I think we have different stories today. Wasn't there something about weather you wanted to talk about?
Look at that beautiful weather. It's 25 outside. We could go up to 27, could go down to 16. Also, Saturday, partly cloudy. Still going to go up to 23, low 17. Sunday, 24, also partly cloudy. And 24, low of 12. So it will at least be hopefully in the 20s for the weekend.
Sounds like some good beach weather.
Which up here apparently is scorching hot. So
that's scorching hot if you ask me.
Yeah. So anyways, we are also waiting for the premiere. And Doug for today, it's just going to be with Christine Elliott. Now, this is not what they call a media availability. Media availability just means that you can ask questions. This is an actual announcement, so there's got to be something they're going to announce about healthcare here, most likely, since Christine Elliott's the Minister of Health. Now, obviously, she's there every day because she's the Deputy Premier. However, today she's the one making the announcement. So we'll see what happens there. I mean, our healthcare system has just been under siege for the last few months.
No kidding.
Particularly in places like Toronto and Peel and around the GTA, Windsor-Essex area as well down there on the Detroit border. Part of the problem there with the Windsor border is there's a big outbreak across the river in Detroit and all the way out into like Lansing and Ann Arbor. There's a big breakout on the other side of the border there.
Michigan's in rough shape, to say the least, when it comes to their COVID cases, as well as the rest of the states as a whole.
Yes. Yesterday, the numbers obviously came out today, but yesterday was the most new COVID-19 positive cases across the U.S.
Over 40,000, I believe?
Almost 40,000,
Almost 40,000,
To put that into perspective, we've only had about 100,000 in all of Canada.
Since the beginning until now.
Yes, yeah.
Scary times. I got a couple friends in the States. They send me these stats, and I just worry for them. I pray, and I hope that something comes through for them.
Yeah, because it's not going to be the president. He wants to slow down testing, only because it makes him look bad.
Well, yeah, he doesn't want those numbers to be out there.
No. And they've reached now, I believe, 123,000 people have died from COVID-19.
All because he's worried about his image.
Yeah, and that's 123,000 people, by the way, that we know of that died of COVID-19 that have been tested.
We don't know of the other people with underlying conditions
that died that could have had COVID-19 because the symptoms are all over the board with COVID-19 too as well.
Yeah, and you don't know whether they may have had an underlying condition and COVID was just, the last straw. And
that's the problem in long-term care homes, is that usually someone in a long-term care home has at least 2 medical complications to begin with.
That's so true, too.
And when you stack on COVID-19 onto someone who already has lung problems, for example, it's even worse, which is why you're seeing it spread like wildfire through the long-term care homes.
You have ties to the States. You're from Florida, too. You've dabbled down there. Do you have family down there still?
No, I was the only part of my family. Well, actually, that's not true. Both sets of my grandparents lived in Florida at various times after they retired. But no, I lived in Miami. I moved there by my own.
So you can sleep a little easier knowing that you don't have any. Hopefully.
Miami has a huge outbreak. Miami Beach just made a requirement to wear masks at all times when you're outside your house.
Wow.
Yeah. So
I'm seeing people now making fake, exempt mask cards as they're the steepest incline of any country, and people are making fake cards saying exempt from wearing a mask. Wake up. Wake up.
Yeah, and the thing with those masks is it's not just, they're actually preventing you from spreading it. People think, oh, if I wear a mask, it's preventing me from getting it.
Yeah.
No, the mask is to prevent you from spreading it because it's the droplets that come out of your mouth. And then the other thing too is I dealt with this just the other day. You need about 70% of people to be wearing masks for the stop of COVID-19 to be able to be stopped by people wearing masks.
Right.
And if you have all these people not participating, then you are in a position where the masks become irrelevant. If you only have 20% of people using them, you might as well have 0% using them because they're like getting a vaccine where you need a certain percentage to be vaccinated or wearing a mask for it to actually be effective. And we know this actually from numbers in Germany and other parts of Europe.
What I don't understand is if I was to say, hey, if you bought a lottery ticket, you've got a 30% chance better at winning if you just do this. You'd be like, yeah, okay, I'm going to do that. You've got a 30% chance lower of getting COVID-19. No, you can't tell me what to do. You can't tell me what to wear. Like, it's not asking you to do 3 backflips in a cartwheel. It's asking you, to be mindful of yourself and others
Putting
around
a mask on is not like doing a cartwheel.
Or 3 backflips. It definitely is not.
Yeah, so we have the Premier coming out in just 1 second. He'll be with Christine Elliott, and they're going to be making a healthcare announcement. We've gotten the sign that they should be here within 10 seconds. And the Premier's there. Here he comes. And we'll be right back after this announcement.
Well, good afternoon. As a province, we're making tremendous progress. And that's because of each of you. It's your sacrifices that have got us to the place today. Businesses are reopening. The number of hospitalizations and ICU admissions are declining. And most public health units across the province are reporting 5 cases or less. Yesterday, we processed over 30,000 tests, resulting in only 111 new cases. We haven't seen case numbers this low since the end of March. So I want to thank our frontline healthcare workers, the efforts of every Ontarian, and our brave men and women from the Canadian Armed Forces. Because of that commitment, dedication, and steady progress, our most vulnerable are safer and more people are headed back to work across the province. But no one has been immune from the impacts of this virus, whether it be financial, physical, or mental. The challenges we've faced have been unprecedented. But our seniors have been hit the hardest by this terrible virus. And that's why we acted quickly and decisively to protect them. It was a difficult but necessary decision to ask our seniors to self-isolate, but it was made to save lives. And I believe if we're able to save one life, someone's family member or friend, that was worth everything in the world. We know most of our seniors listened to the advice and stayed at home to protect themselves and protect their loved ones. This has been difficult on many, being deprived of seeing family and friends. As soon as public health trends started improving, we found a way to safely resume visits to our long-term care homes and retirement homes. We allowed households to create social circles of 10 so people could hug parents and grandparents again. We invested $11 million to help community organizations deliver food, medicine, and necessities to seniors in isolation and those with disabilities. And we partnered with Spark Ontario to help recruit over 6,500 volunteers to check in on our seniors and help those in need. Today, I am proud to announce an investment of an additional $4 million to further support organizations that are helping seniors in their communities. This funding will allow grassroots organizations to develop programs for seniors that focus on combating social isolation, promoting senior safety and well-being, improving financial security, and making communities age-friendly. We're providing this additional support because our seniors deserve nothing less than to live with dignity and respect that they have earned after a lifetime of contributions to their communities. As we gradually reopen the province and more of our seniors get out into the community again, please continue to follow public health advice, practice physical distancing, and wear face coverings when physically distancing is a challenge. Wash your hands frequently and stay home when ill. This is the best way to keep everyone safe. My friends, I will continue to do everything in my power. We will pull out all the stops. We'll leave nothing on the table when it comes to protecting our seniors and most vulnerable and the people of this province. Because we're talking about someone's parent, talking about someone's grandparent, someone who built this country and this province. That's worth more than anything in the entire world. And that's who I'm going to keep fighting for each and every day. Before I close, I want to give a big thanks to Vail Canada for donating 65,000 N95 masks to the front lines of the agriculture sector. Minister Hardeman, Minister of Agriculture, was a champion and helped secure donations to OMAFRA headquarters in Guelph. And now the masks are going out the door as we speak. It's great to see the Ontario spirit is still going strong. Thank you, and God bless the people of Ontario. I'll take questions now.
Okay, we'll go to the phone line for questions. First question.
First question comes from Ashley Legasic from News Talk 1010. Please go ahead.
Hi, Ashley.
Hi, Premier. How are you?
Fine. How are you? Good.
I'm good, thank you. My first question is about an outbreak at a Kingston nail salon. It's now led to 18 cases of COVID-19, and apparently over 500 people have been at the salon since it reopened. Does this give yourself or Minister Elliott any second thoughts or any pause regarding the current state of the reopening plan?
Well, it's concerning. It's ironic you asked the first question because the Minister and I were just talking about it walking down here, and what it shows is the system's working. That's the first part. The system's working because how quickly we contacted and traced the 500 people. But it goes back to what we keep saying. You know, we have to always make sure that we wear face masks, we constantly wash our hands, and when possible, make sure in groups that we really stick to 10 people, the social circle. And I'll pass it over to the Minister, and maybe she'll have a few comments.
Well, as the Premier indicated, we are able to do the tracing now, that we are able to follow, that we're able to make sure that we're in touch with anyone who was at the salon, who received services, that they now should be tested themselves, that they may need to go into self-isolation if they test positive, but it does show that our system is working. It doesn't mean that we need to move back on anything that we've moved into stage 2, but we are continuing to follow it to make sure that the appropriate precautions are taken and that the appropriate follow-up happens, but it is.
Follow-up.
Thank you. And at this point, Premier, are you able to speak on whether stage 3 of the reopening plan will also have a regional approach, and when can we start seeing that?
Well, we actually had that discussion today on our cabinet meeting, and we're going to take a cautious approach, but we're going to rely on all the chief medical officers, all 34 of them across the province, and I'm sure that we'll be doing the same staged approach. And it's all about making sure we have good communications with all the chief medical officers, and Dr. Williams is doing that, and they're doing a great job. So again, I can't give you an exact time. Both the Minister and I, we want to move this forward, but we're only going to move it forward based on the health and science and making sure that we're very cautious. You know, you look at the numbers yesterday, 30,000 tests, you know, as I say, they're running like a well-oiled machine, the testing side of things, and we haven't seen those numbers of 111 since March. So if we continue moving forward in a very cautious approach, we won't take that, well, we won't see the same events that are happening down south of the border in the U.S. right now. It's, if I'm not mistaken, the other day, they had 36,000 cases in the U.S. in one day. We had 300 cases in all of Canada. And even if I know they're 10 times the size, even if we multiply that 300 by 10, that's 3,000 versus 36,000. So I guess what I'm saying is that's the comparison. Being cautious and everyone following the protocol, which they have, and I'm just so proud of the people of Ontario, versus a reckless approach, in my opinion, south of the border, that everyone just goes hog wild and don't worry about anything. Well, that's come back to bite them. And we just pray to God that doesn't happen up here.
Next question.
Next question comes from Colin DeMello from CTV News. Please go ahead.
Hi, Colin.
Hi there. Good afternoon, Premier. I had a question about masks. As you know, Markham is now looking at making masks mandatory for indoor spaces. I know that your general recommendation is that people should wear masks, whether they're outdoors or indoors, especially if they can't maintain physical distancing. But there are a lot of people who live on the border of Markham, and we're starting to see these patchwork of policies, and people who might live in Toronto but shop in Markham might be caught somewhere in the middle. Premier, why not take that regional approach to masks and say everyone, as an example, in the GTA should be wearing masks?
They can do it now, actually, Colin. It's up to the chief medical officer. I've talked to Mayor Scarpitti about this, and the chief medical officer of York Region. That's their choice. If the chief medical officer of Toronto wants to implement that, they're welcome to. Under Section 22, they have a lot of power to change things. So if the community, the mayors, and everyone wants to do that, they're good luck to them. I don't disagree, by the way.
Follow-up?
Thank you, Premier. But if you don't disagree with the idea of everyone wearing masks, why not just make it a provincial policy so that it's uniform across the entire province? You
just can't enforce it. You go up to the rural areas way up north, and there's no cases. As much as we can tell them to wear masks, they aren't wearing masks. Our MPPs are telling us up in rural areas they just aren't wearing masks. I encourage everyone, but we just can't enforce it. That's the problem here, Colin. But again, it's up to the local chief medical officer. If they want to do it, then God bless them. Well, all the power to them. I think it's a good thing when you're out in public, wear a mask, wear a face covering. And that's the reason we're at the numbers we are, because everyone's listening.
Next question.
Next question comes from Matt Simard from Radio Canada. Please go ahead.
Come on.
Oh, hi, Premier. My question is for you. The Canadian Armed Forces are leaving long-term care homes, except you've asked for an extension at Woodbridge Vista Care Community. Can you give us the reason why you still need the military there, and are you confident that the situation will get better in just 1 week?
Well, I want to thank the Canadian military. They're absolute champions. They've done an incredible job, and they aren't leaving until all the the long-term care homes, I should say, are in the green level, and make sure that it's a secured environment for the people in long-term care. And that's why we asked the military to stay one week longer in Woodbridge. But the other homes are in green. They're doing better, but we have to be vigilant on this. We have to constantly watch us.
Follow-up?
And do you have a plan to deal with the staffing shortage at long-term care homes now that the military are leaving? And could you ask the Red Cross for help, like in Quebec?
I do. I'll pass this to the Minister of Health. Thank you.
Well, what we're finding is many of the staff members of long-term care homes who left when the homes were in outbreak, now that the homes are stabilized, that they're following proper infection prevention and control procedures, that they have the necessary PPE in order to do their work. We're finding that many of those staff members are coming back. So while they might not be at the pre-COVID levels yet, they are coming back, and we are still in the process of bringing more people on board, training them. We want to make sure that they will stay there, but that's going to be necessary and dependent to a large degree on making sure that the public health precautions are being followed. So we are going to be following up to make sure that happens with the inspections and so on that are continuing by the Ministry of Long-Term Care. That's a very important factor in keeping staff in place.
Next question.
Next question comes from Cynthia Mulligan from City News. Please go ahead.
Hi, Cynthia.
Hi, Minister. While you're up there, I guess I'll ask my first question for Minister Elliott. Oh, I'm sorry. Now you've moved. It's a few seconds behind. So hello, Premier. I know the verdict is not in yet. The judge is still reading it out in the trial of an off-duty police officer and his brother assaulting a young black man, Devontae Miller, who lost an eye. This is another example of what many people are calling systemic racism in policing. Could you address this and what needs to be done to eliminate this kind of serious concern that this is an ongoing problem with police and the black community in particular?
Well, let's first of all, let's see what the judge's decision is, because I can't comment since it's in front of the courts. But I understand, Cynthia, there's so much pain out there in the communities right now, and I've heard from so many people in the past few weeks, and I know there's so much work to be done, and I'm committed to do that work to make sure that we end any systemic racism anywhere in this province. So I'm going to make sure that we continue on the path of we're working with communities, and we have to work with police to make sure they have the proper training, and there's a whole bunch of tools that we're going to be using to make sure that we work with all different groups here.
Follow up?
Well, Premier, can you give me some specifics on how you plan to eradicate systemic racism in policing, and do you acknowledge that there is systemic racism in policing?
Well, I've said it probably a dozen times. Yes, there is. And secondly, that's why we brought on Jamil, as all of you met before, and working with the communities, and not just the Black community, all communities that feel that there's been racism towards their community. And we're a great country, a great province, and our strongest strength and the number one selling feature that when I go out and around North America to attract businesses, I always say the diversification. The vast majority of us, Cynthia, we all live together, no matter race, color, creed, and a vast majority all work in the same environments, live in the same neighborhoods. We can work together and resolve this. It's not going to be easy, but if we work together and everyone listens, we're going to get through this together, and that's the only way.
And welcome back. That was the Doug Ford's daily press conference. Today he was joined by Christine Elliott, and what they were announcing was what's called the Seniors Community Grant Program. This program happens every year, but they've increased the funding this year, and what the funding goes for is an organization can apply. You can anywhere from $1,000 to $100,000, and this goes towards community support, such as people who are in social isolation, for example, and neglect, fraud, and abuse, and then also older adults and helping them find employment and volunteering activities to do as well. So that was the announcement today from Doug Ford and Christine Elliott, who's the Minister of Health. And speaking of people staying healthy, what's going on with the roads in the next week?
Yes, as everybody knows, Canada Day coming up this following work week, that Wednesday, breaking up that work week oh so nicely.
2 days, 2 days.
Yes.
We actually go like 2 days off, 2 days on, 1 day off, 2 days off, on, 2 days off, and then back to 5 days a week.
See, that's not bad at all. But during this time, usually the long weekend is usually a time where the RCMP will ramp up a little bit just to make sure the roadways are safe. This time they're looking for the big four all week, which is alcohol, drug impaired driving, inattentive driving, aggressive driving, and lack of occupant restraint use. And a reminder that any of these also happening on waterways or on ATVs are the same charges regardless of what vehicle you're using.
Yes, and for the individuals I've seen driving around the back of pickup trucks, there's no pickup trucks on the market with seatbelts. So just want to clear that up.
Right.
Because apparently there's a few people driving around town the other day that thought that there was seatbelts, I guess, in the back because, yeah.
Because you saw a few people taking a little
I had three
spin,
pickup trucks go by me in a row with a bunch of young people in the back. And then there was no seatbelts in the back of those pickup trucks.
Well, it's the same as when you see a dog in the back, and sometimes it's just like, no,
like, what are you doing? If you brake quickly, your dog's going to go flying.
And all things that the RCMP is looking for this weekend. So make sure, if you're out having fun, make sure you do it responsibly. We want to see as many of you, we want to see all of you just the same, get through that week and have fun while doing it. But you just got to make sure you're doing it safely.
Yeah, so make Canada Day fun. Don't make it a trip to the hospital. We'll be back after this break. Hold tight.
What's life without making a few mistakes down the road? A few sharp turns. And doing things for what we adore, but might regret later. A trip to Chuck's Roadhouse isn't one of them. With melt-in-your-mouth AAA steaks, buttery lobster tail, half-priced apps after 9 p.m., an ice-cold draft with all your Roadhouse favorites. Chuck's Roadhouse. Food the way it ought to be, priced the way it used to.
a message from the Government of Canada.
In your home, lighting is just as important as style.
With PowerView Motorization from Hunter Douglas, you can schedule your shades to light up the room. Create privacy, or both, automatically. No hands required.
So your shades will always be in the right place at the right time in style. And it's only from Hunter Douglas.
And welcome back to Special Report. I'd like to thank KC Securities for your sponsorship of both the morning and afternoon edition of Special Report. Time to do our Facebook shoutouts.
Let's do it.
Hi to Jasta, Tammy Lynn, and Sean. Thank you all for watching and either commenting or liking our broadcast today on Facebook Live. And now we're going to have video. This is from the Finnish Rest Home, the Finnish Festival of the Midsummer Celebration. They did a parade around the property. Apparently they have about 200 acres there or something.
Yeah.
So they did an actual 30 cars, the parade around the property. We're going to see the video now, and you can see the full story up on Sue Online as well. So we'll run that video for you.
Starting at 2 o'clock, we normally would do a parade with the residents in wheelchairs. We have their wheels decorated with the blue and white flowers, and we have a parade that goes through the back center courtyard. We have entertainment here, we have games, we have a big barbecue. We invite the community to participate, and it's an afternoon affair till about 6 p.m.
Today is the Finnish summer solstice. It's celebration of summer.
Yeah, it's midsummer celebration in Finland. We call it Juhannus, and generally in Finland it's celebrated between June 26th and June 20th and the 26th, pardon me. And basically they decorate their doors, their windows with birch. They all get together. It's celebrating the start of summer. It's the longest, brightest days in Finland and in the Nordic region. And yeah, everyone gets together and has fun, and we celebrate.
It's usually a really big celebration, and with everything going on this year, we just felt they needed something, and we need to make it not about COVID-19, but about their big celebration, Johannes. And the residents look forward to it every single year, so we wanted to make it big. And because we had to have the social distancing, I'm just so blessed that there was an outpour of people coming in and wanting to be a part of this, and it got so big, and it was so wonderful. It was so happy and emotional and exciting, and all of our residents wore their blue and white today, and it was really nice.
Yeah.
And that was the Finnish Festival, the Midsummer Celebration that was over at the Finnish Rest Home. Thank you to Danny Dupree for covering that for us here at Sue Online and on TV. For those of you who were watching this morning at 9 o'clock, since 8 o'clock our sound didn't work, so we had to come back at 9, we talked about Colette Linden. She's my normal co-host on the show. Unfortunately, this past weekend on Friday, she was burned in her house. And we are trying to raise $5,000. She has increased expenses from childcare and also, obviously, government therapy and things like that. The link you can see at the bottom of the page there. However, if you go to our Facebook page, it is pinned at the top, and you can click through to donate. We are actually up to, you're going to see on your screen $12.85, but literally like 1 minute ago, someone donated $100. So we're now up to $1,385. Anyone who donates $25 or more this weekend on Monday morning, Alex and I will actually go through the list of all the names of anyone who donates $25 or more by Monday for that, for Colette. And I greatly appreciate it. And all of us do here at On TV if you could. So please do that, and we'll see you Monday, 8 a.m. Have a great weekend.